Hello and welcome. I'm Vincent McCory. This is Africa 54. Now, topping our newscast this evening, two major health stories are bringing worldwide attention to Africa. While in East Africa, South Sudan is mired in political chaos and conflict. And now aid agencies say South Sudan could be headed for the worst famine since the mid-1980s, when over 1 million people died. We'll have more on this story in a moment. Now, in West Africa, the Ebola virus continues to claim lives, with dozens of new fatalities being reported in Liberia, Guinea and Sierra Leone. Liberian officials are struggling to cope with an increasing number of bodies of Ebola victims left unburied in communities affected by the deadly virus. Well, joining us now with more on the Ebola outbreak is Africa 54 health correspondent Linord Moudou.
Hello, Vincent. Hello, everyone. Due to the Ebola scare, many health centers in Liberia are closing as medical personnel are refusing to come into work as they're afraid of being infected with the highly contagious disease. A hospital in the Liberian capital is deserted. A lone security guard monitors an empty car park. Many health centers like this one are closed at a time when the country urgently needs medical help. The Ebola virus has killed nearly 900 people across 4 West African countries since February. Medical personnel here in Monrovia are too afraid of catching one of the world's deadliest diseases to come into work.
The health workers think that they are not protected. They don't have the requisite materials to use as to protect themselves against the Ebola diseases. So many of the health workers, including physician assistants, nurses, and so forth, are staying home.
Suspicions, superstitions, and fear are rife in Africa. These villagers don't want the victims of Ebola buried here, as they're scared they'll become infected. Specialists say the point of death is the time when a body is most contagious. Ebola kills up to 90% of people infected and has no known cure. Liberian Information Minister Lewis Brown told VOA that officials were unprepared for the negative response they are getting from the communities. Meanwhile, Liberian President Ellen Johnson Sirleaf has ordered cremation of Ebola-related bodies. Aid agencies say a surge in the number of children dying every week due to preventable illnesses in a displaced people's camp in South Sudan is troubling. According to UNICEF, more than 20 children die every week due to preventable illnesses like diarrhea, malaria, and pneumonia, which is then underpinned by malnutrition in the world's newest nation. A scale-up of responses in healthcare and water and sanitation by aid agencies has halved this number, but as the rainy season takes hold, so does the risk of disease. At this moment, 4 million people, more than 1/3 of the country's population, are now believed to be facing emergency levels of food security.
Life here is not good, as you have seen. We are now moving to another place because the entire place is getting flooded.
This is the hunger gap. I know, because of this displacement, most of the families were not able to cultivate. So the hunger gap is expected to be a bit longer. So we'll have also an impact of malnutrition situation. So malnutrition situation is worsening. Diseases are also increasing. Like we'll be seeing more diarrheal diseases. We'll be seeing an increment in pneumonia. So these are the things that will also at one point increase the under 5 mortality.
And at least 10,000 people have been killed and more than 1 million displaced since clashes between rival army factions broke out in December. That's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks. And I'll be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54. We want to know what you think about Africa 54 and the stories we covered. Join the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com.